Some very interesting medical news for you. Scientists say they've developed medical devices that do the work they're designed for inside your body and then just dissolve. What happens to them? That's one of the questions we have for Dr. Ernest, Patti. He's senior attending physician of emergency medicine at St. Barnabas Hospital in the Bronx. So, Dr. Patti, I mean, what are we talking about here? Medical devices that dissolve. Come on.
We're talking very exciting Star Trek-like things. Small electronic devices, they call them transient electronics, that are made out of silicon and magnesium, and they're covered in a little silk cocoon. They use silk in varying degrees of varying thicknesses because the silk is absorbed by the body, as well as the silicon and the magnesium.
So what's a scenario where someone would have a medical device like the one that you're describing?
Well, these are, the field is broad. I mean, we can use them for measuring temperatures and measuring different levels of hormones. Right now, we have some devices that we implant into the body. I mean, you know of pacemakers,
sure,
insulin pumps, things like that. But the problem with those devices is they need to be surgically removed once their useful life is gone or done. These things are exciting because you can program them to last for a certain period of time, months, years, days. Once they dissolve, they're gone. The body absorbs the electronic components.
Okay, when you say absorb electronic components,
okay,
it sounds a little weird and kind of dangerous.
Well, first, let me explain. They're extremely small. I mean, I brought a small example. I don't have one of the devices, but this is a SIM card, which would represent a small size of an electronic circuit board like this, which is made out of very minute amounts of silicon and magnesium and the silk. And these components get absorbed, they dissolve in water, and the body then absorbs them.
Well, you're an emergency room doctor, right? I mean, sure, you see a lot of folks come in with a lot of different issues and problems. I mean, do you see any risk to this?
Well, obviously, if it's a large size, Jenna, if we're talking a big device,
okay,
then that could be potentially a problem because you'd have high amounts of the chemical components that make these circuits. But we're talking minute amounts that the body can handle and absorb and excrete. Isn't that amazing?
When you think about some of the stuff that we do put in our body already, I guess, you know, like a Big Mac, for example, maybe a medical device that dissolves isn't that big of a deal.
Right. They're extremely small, and the field is wide open and extremely promising to be able to use these things and not have to go back and retrieve them. That's the good thing.
Maybe you can ingest them while eating a hamburger at the same time. Now we're getting into a completely different area.
Definitely.
Wishful thinking on my part. Dr. Patti, always nice to have you.
Thanks so much for having me.
Thank you very much.
I appreciate it.
Greg?
As Jenna mentioned earlier, cool but kind of creepy.
Exactly, right.